Hi, I'm Phil T. Rich, official spokesperson for the healthcare industry, and I'm here in Washington, D.C. to write a new healthcare prescription for you. Don't worry, it'll only hurt a little bit. I'm not a doctor, I just play one on Capitol Hill. Actually, I'm a shill for the insurance industry, big pharma, hospital corporations, the healthcare industry. And I'm here in Washington, D.C. because Congress is trying to write legislation for healthcare reform. Reform? What's wrong with our system? We're making plenty of money right now. Why do they need reform? Congress is hard at work on it, but we've been pretty successful so far. First of all, we beat back single payer. Now, I know that would have been the perfect prescription for all of you out there, but for us, it would have killed our profits. Well, we were lucky we got single payer off the table. But then those darn Democrats come back with what they call the public option. The public option would set up a government-run insurance plan that would compete directly with our fine health insurance companies. Well, this kind of competition just can't be tolerated. Competition would mean lower insurance premiums, lower drug prices, lower hospitalization costs. What is this with competition? Don't they realize this is a capitalist country? We don't want this public option, so we're here to write some prescriptions. Now, I'm going to write prescriptions for those Democrats on Capitol Hill. I know this doesn't look like a prescription pad. It's not. It's my checkbook. That's the kind of medicine these politicians understand. Let's see, I'll write a prescription for Harry Reid. He's the Senate Democratic leader, you know. He's going to get $1.9 million. $1.9 million for Harry Reid. Another example, Ben Nelson, powerful senator on Capitol Hill. He's going to get a prescription for $2.2 million. That's right, $2.2 million for Ben Nelson. Dianne Feinstein from California. She's going to get $1.7 million prescription. All this from the healthcare industry, from insurance companies, big pharma, hospital corporations, things like that. The other California senator, Barbara Boxer, she's getting $1.3 million. Not as much as Dianne, because she's the junior senator. And big prescription for Max Baucus, because he's the senator in charge of the Finance Committee, and he's going to actually be writing this legislation. So he gets a nice prescription for $3.9 million. $3.9 million from the healthcare industry to Max Baucus, who's in charge of writing healthcare reform. So, in total, the healthcare industry has given over $80 million to all the Democrats in the Senate. It's just amazing. That's the kind of medicine they really understand. Just a spoonful of money helps the medicine go down, the medicine go down, the medicine go down. Just a spoonful of money helps the medicine go down in the most delightful way. Hi, I'm Paul George. If we're going to get anywhere on healthcare reform this year, we've got to stop the influence of all this money that's going to Capitol Hill Democrats. $80 million to the Senate Democrats. The healthcare industry is trying to buy off our reform. 76% of the American people support the public option. We've got to let our senators know. Pick up the phone and call your senator today. Check out WeWantThePublicOption.com. You can find out how much your senator has gotten from the healthcare industry, insurance, big pharma, for-profit hospitals. Find out how much your senator's on the take for, and then call them and tell them you want the public option. The phone number's on your screen. Do it today. It's important.